What's up, you guys? It is Kyra and I'm back again with another video. So I do just want to say sorry about the lighting. The sun is going down when I'm filming this, but I had a very busy day and I wanted to come to you guys and film this video because everyone keeps asking me what is on the RMA exam, what's the exam like. So I'm guessing that a lot of you are getting ready to finish your programs up or graduate, whatever. I'm so happy for you guys and I hope that you do well on your exam, and I hope that this video is not too late. But I do just want to say I am by no means an expert at this exam. Only took it once and this was a while ago, and I kind of just let it behind me, kinetic memory. Okay, you guys, but before I start this video, I do want to say I just started Instagram and a TikTok just for medical content, just for sciencey content, study tips, stuff like that. If you're interested, go ahead and follow me on Instagram and on TikTok at medically aesthetically. I will have it on the screen in case you guys have trouble saying it or spelling it. It is medically aesthetically. That is my new brand. I will be launching products pretty soon, but for right now I am just doing Instagram and TikTok, and I hope that you guys decide to go ahead and not subscribe, I guess follow those too. Okay, you guys, so for the most part the RMA exam is broken down into technically 3 categories. This is your general category, your administrative, and your clinical. But within those 3 categories, there's multiple different things that will be on the exam. Like I said, I am not an expert. All I can do is tell you guys what stood out for me. So y'all, let's get right down to business. I realized that the camera's gonna flip this, but whatever. This is the book that my program gave us to study for the RMA exam. And as you guys can see, I know it's a little blurry, but just to give you guys an idea. Oh, that's something important I need to talk about actually. You can see throughout this book, I have a lot of highlight. I went through and basically took all these practice tests and highlighted the answers in the book. But for the most part, I would say some of it's on it and some of it's not. Now, if you're a cheater, let me go ahead and get this out the way. You're not going to be taking the same exam as the person next to you. So don't even think about cheating. You'll just make yourself look like a fool. The exam can be anywhere between 150 to 215 questions depending on which version of the test that you yourself get. To go into something that I really think you guys should study, since this just popped up, let me mention it before I end up forgetting it, is the medical positions. You know, your supine, your lithotomy position, your sitting position, flowers positions, prone positions. All of the medical positions, go ahead and remember those because you're probably going to have a question about it. So starting off with the general section, I would say that the general section has a lot of A and P in it. So my tip to you guys would be to know the big concept things, because I know for a fact one question that I can remember was on my exam is, where is the liver located in the body? So they'll ask you questions like that, and you kind of just need to know the answer, because to me those are the easy questions that you can knock out like that to get your score up, because in most states you need at least a 70 on this exam to be an RMA. So they're going to ask you questions like, where are certain organs located, and they might do the same with muscle or skeleton. Now, I'm not saying go back through that whole section and relearn all the bones or the organs, but I'm saying have a pretty good idea. Like, you guys have to know how to narrow stuff out in questions and figure out what's the best example. And then the next thing that I would remember being in the general section is just common knowledge type of questions. Like, they'll ask you, what do you do in an emergency situation, or just, I don't know, just random common knowledge questions. That's what you'll find in the general section as well as A and P. Then moving on to the administrative section, I would say HIPAA. You guys need to know your HIPAA laws. They'll ask you scenario questions, and you need to know what to do in certain scenarios. You need to know all about HIPAA, what you can and can't do, what violates patients' rights, and all those kinds of things. And then also another administrative thing that I saw on my RMA exam is questions kind of about billing. Now, don't focus too much on this. You don't need to go super into depth. but I did see a few questions that were kind of basically saying, it was about collections. Like, how long does the patient have to pay their medical bill before it goes to collections? Da 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 da. Those type of questions, try and know the answer to maybe for the administrative side. And then they also did ask some questions about like postage and mailing things, which I thought, why do we need to know this? We'll never need this. But now that I'm an actual RMA, I mail out a lot of stuff for my doctor, so I pretty much understand. And then the very last section of the exam, the clinical section, is about all that hands-on stuff you learn. They'll pretty much ask you all that information, and you kind of just need to remember. And that's why it's very important that you guys are paying attention during your hands-on sessions. Now, while we're talking about the clinical section and the hands-on, this is the book that I had when I took phlebotomy and learned phlebotomy. You guys, do not worry about phlebotomy at all for the RMA exam. They may sneak a question or two in there about it, but you really don't need to know phlebotomy for the RMA exam because it is a separate exam in most states. Like, you have to have a phlebotomy license, a CPT, as well as a RMA. So don't focus on phlebotomy when you think clinical stuff. I do believe that on my RMA exam, there was a question about which vein do you never go for when performing a venipuncture or whatever. But for the most part, phlebotomy is not relevant to the RMA exam. And another tip that I have for you guys is, here's my medical terminology book. I would say know your prefixes. Let's see how this is digit, and then it says finger, toe. And then what else do we have? An easy one. I'm trying to think of an easy one. I opened a hard page. Or they have RADI, ray. So you know, like all that type of stuff is related to x-ray, radiology, all that kind of stuff. Know your prefixes, because for me, prefixes can save you if you don't know the answer to the question. Because once you can kind of piece stuff together, if you know a little bit of what something means, then that'll help you answer the whole question. And even if you don't exactly know the answer, it gives you better chances if you know what we're talking about. So terminology is very important. Lastly, I would just say that the RMA is a timed exam and you only have 3 hours to complete it. But please, 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 don't go into this focused and worried about time. Just take your time. I swear you're not gonna run out of time unless you're moving like a snail. You're not gonna run out of time, so don't focus on that. Just focus on answering the questions to the best of your ability, not second guessing yourself, and knowing your terminology so that you pick answers that make sense. Okay, you guys, if you're not already subscribed to my channel, make sure you go ahead and hit the subscribe button so you can be a part of the My Mob, and I'll catch you guys in my next video.